Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Today's episode is all about a question that so many women find themselves asking when they are stuck in their fertility journey. What else can I possibly do? If you've been trying to conceive, going through IVF, or navigating conditions like PCOS, endometriosis, or unexplained infertility, you have probably heard about acupuncture. But does acupuncture actually help? Today, I'm joined by Emily Marson, founder of Aphrodite Fertility Acupuncture, who specializes in helping women identify and treat the root causes of infertility using a blend of traditional Chinese medicine and modern fertility care. In this conversation, we talk about how acupuncture works, why fertility is about more than just hormones, and what's really happening in the body when things like inflammation and stress are present. We also talk about PCOS, male factor infertility, IVF outcomes, and why so many women feel like they're doing everything right, but still not getting any answers. Hello, everyone. Today I am here with Emily Marson. Emily, do you mind telling us a little about yourself and what you do?
Yeah, sure. So I am the founder of Aphrodite Fertility Acupuncture. It's in San Diego, California, and it's an acupuncture clinic dedicated to women who are struggling to conceive, and then we take them through pregnancy and postpartum. And so what we do is we integrate Eastern medicine, so acupuncture and herbs, with Western sort of functional medicine, and we basically combine the two for the golden age of fertility care, where we can really dig into complex cases that walk into our clinic who have maybe been either pushed aside or they're struggling to achieve success via the Western system. And we combine integrative care and get these women to their healthy, happy pregnancy and their families.
What is it that got you interested in acupuncture?
Yeah, it's a great question. I was working in finance in New York, hating it. And I was over exercising on the weekends and I tore a tendon because basically I was sitting all week and then I went on to run my frustration with finance away. So I tore a tendon, I had surgery on it, and the surgery failed. And then I ended up having sort of like a nervous system disorder from the surgery or response, I would say. And so I was seeing all of these specialists, Western medical specialists, like the foot doctor, the nerve doctor, the sports medicine doctor, and everyone was sort of just looking at me through the lens of their specialty, and they weren't putting the whole picture of how my body was responding together. So, like most people do, out of sort of desperation and curiosity, I went to see an acupuncturist in New York, and she was the first person to ask me about like my whole body and how it was connected to the pain response that I was having post surgery. And so I was like, "Oh, what is this?" Like she actually listened, and we spent an hour together, and then she put some needles in me, and it started to heal. And I was looking for a reason to get out of finance, and so I was like, I'm curious. So I packed my bags and I moved out to San Diego, which is where one of the top colleges for Eastern medicine is, grad programs. And it's so amazing because it combines not only Eastern medicine and acupuncture, but also philosophy and history and culture and just a whole like mishmash of really deeply intellectual sort of subjects together in combines into medicine, and you can really help people. So when I was there, I was working, and my clinic shift ended up being on a Saturday because that's the only time I could do my clinic work. And that ended up being under the care of the women's health and fertility supervisor. I thought I was going to go into acupuncture via sports medicine specialty because of how it helped me. But I started to fall in love with the patients that would come to see her, women who were having cycle irregularities, pain, trouble conceiving, miscarriage, menopause, anything that has to do with the woman's body and hormones and health, women's health. And I didn't really know what I was doing at the time, but I tended to have honestly better results than maybe my peers. And I was like, wait, the universe is telling me something. Like, this is what I should really look into. And so after school, I started to study the specialty of fertility and went deep and became obsessed with it. And I took all the courses I could find. I took all the nursing, IVF certificates to deep dive into what was happening on the Western side, and really have dedicated my life to, from the beginning of setting up my clinic, to fertility care and helping women out of a very dark period of their lives.
And I love so much that you're doing that because women's health, I feel in general, is, something that's overlooked a lot, not given a lot of attention to, just thrown band-aids like get on birth control, that fixes everything, or, things like that. And oftentimes things like acupuncture aren't even covered by insurance. They're not talked about. Western doctors don't, quote, believe in it. I mean, it's
Yeah,
crazy.
it's interesting. Of course, came into this as in like a Western perspective. And I also would say, oh, I now believe in acupuncture. But the more that you're in the field, the more you're like, you don't say that about medication, a Western medication. It's like, you're not like, I believe in Western medication. And Eastern medicine is medicine. And you can think of it as medication, as changing your physiology. And so it's really not something like you believe in. It's something that like changes your body. And so I have like shifted my language around it as well. And the other thing is they know that it's not just placebo. Like a lot of women come in and they find us, again, sort of like out of urgency. They've tried everything else and they're like, well, I think stress plays a role. I'll just go like, have acupuncture and lay down for an hour. And they know, of course, we are working on all of the body systems and we can get into how acupuncture works, but they know that acupuncture isn't just placebo because it works on animals. So there are plenty, especially here in Southern California, there are plenty of veterinary clinics that do acupuncture. Let's say your dog has arthritis, the dog doesn't know that they're getting acupuncture, and then that changes like, how their response to it. They don't know what's going on. They have acupuncture, and then the dog gets up and walks like it hasn't walked in 3 years because of the crippling arthritis. So there's also ways that Western medicine is trying to understand it as well. For example, there's a point on the foot that is in Chinese medicine classically described as brightening the eyes. So in the text from 1,000 years ago, the Chinese mapped that if you put a acupuncture needle into this point, the eye function changes for the better. And so they've done functional MRIs. So they have a patient lie in an MRI that is scanning the brain as the acupuncturist is putting the needle into this point. And they can see that it lights up the visual cortex of the brain. So while Western medicine doesn't know like which system it is working on and how it is working, they do know that it works. So I like to sort of, what I'm good at Aphrodite is sort of translating away from like, oh, it's this sort of mysterious magic stuff that maybe will help me rest and that maybe that will change my outcomes, to know that this is actually working on the physiologies of your body to sync up all of the systems that need to sort of cascade in a certain order in order for you to have a healthy outcomes and healthy pregnancy. And that's how I think we are really able to translate what Eastern medicine can do for the Western woman who comes in and needs help.
And I love that you break it down like that because you're right. So many people think, oh, I'll just go relax. It must be, just to prevent stress. But, as I mentioned, I did acupuncture. I have PCOS. I was having like 90-day cycles, non-existent cycles. I mean, within like a month of going, and I was only going once a week, a month of going, I had a regular cycle. And I'm like,
Amazing.
what? Like,
Yeah.
all you did was put some needles in. But I mean, obviously, it's more than that. But, it's, yeah, I mean, I had great results with it. So I guess
Yeah.
I'm curious. I know it can probably be a question that could have a really long answer, but how does acupuncture work? Like on a
Sure. Yep.
basic level?
Yeah. So I'm going to explain it as I do to sort of the Western mind and the Western women who come into the clinic. This is a translation basically of of the theories of Eastern medicine with Western medicine sort of overlaid on top of it. Okay, so when you rub your hands together, it creates a heat, right? So movement creates heat. Most people can get behind that. Like when you run, you sweat. Okay, so movement creates heat. So your organs move. Okay, so your heart pumps and your kidneys filter and your lungs expand and contract. And so there is a heat coming off of the organs. Now, heat is energy, right? Like when you turn on a stove, that heat boils water. So heat is energy. And this energy that comes off of each organ, so like the heart's heat that comes off of the heart flows in certain patterns in the body, just like anything else in the body, like your blood vessels and your nerves, they all have patterns that they take, pathways that they take in the body. So does this heat that's coming off of the organs. Now, this heat isn't really accounted for in Western medicine. It's not really mapped. It doesn't have substance to it. Like heat is invisible. And so it hasn't really been captured by the Western medical system. So the heart heat, let's say, comes off of the heart and travels down the inner aspect of the arm. And the Chinese mapped this 1,000 years ago. We call this heat qi. So you might have heard of qi as like, people describe it as like energy, but really I want you to think of it as heat. Okay. So the organ itself, if it is under functioning, so deficient, or if it is over functioning, so like in excess, you can think of that as like rapid heartbeat or maybe inflammation, or if it is if that heat pathway is stagnated along that course that it takes, then there will be a certain set of symptoms. And so we as acupuncturists we ask you all the questions about your sleep and your mental health and your, if you have heartburn or headaches. And these symptoms all map to one of those three patterns for each organ. So deficiency, like under optimization of the heart working as it should, and maybe a deficiency of its heat pathway. So it's either the organ itself or its heat pathway can be deficient, or it can be stuck, or it can be in excess. And excess heat is inflammation. It literally is, inflammation literally is at heat. You can feel it, or you can see it. So I like to take the heart as an example. So if you have excess heat coming off of the heart, so that's called like heart qi or heart heat, then you have heat coming off, and heat in nature always rises. And so the Chinese say the heart heat comes off the heart and will rise to the head. And when you have heat in the head, like what symptoms do you associate with heat in the head? That's like overthinking, like overactive brain. That's like anxiety. Most people with anxiety have a sensation of like heat rushing up, maybe to their cheeks. And that can also be like insomnia, like heat at night, like movement of the heart heat coming up into the brain, and overthinking at night. And so these sets of symptoms would tell me, okay, the heart heat is in excess. Okay, so now we have sort of like the diagnosis that I'm able to map to. So what do like the needles do and the points do? The other thing that the Chinese did was map along those channels. And you can actually feel them if you were to go along like the inner aspect of your arm. There are little like sort of dips in your skin. They almost feel like little wells. Those are acupuncture points. And this is where the Chinese mapped, okay, does this point, if you put a needle into this point, does it bring up a deficiency of heat? Does it bring down a deficiency of heat? Or does it push through maybe a stagnation of that heart heat pathway? And so depending on your symptoms and then the diagnosis, we choose certain points to bring up, bring down, or push through the sort of pathology of the heat coming off of the movement of the heart. And that restores that flow of heat, like physiologically. And when you do that, then you have all of the body's systems and the organs and their heat pathways able to synchronize. And this is really where Eastern medicine and Western medicine differ. Western medicine is really about the substances of the body. Okay. So like, the brain talks to the ovaries talks to the uterus, and we cycle back and forth. But there is a in your DNA, there is a sort of mapping of all the processes that need to happen in order, in sync with all of the other processes that are happening in your body. And those all have to come together in a certain cascade. And that cascade happens on this movement pathway, right? Cascade is movement. It is movement, which creates heat, which so is chi. Okay. So when we talk about chi and heat, we're talking about the body's ability to sync up all of the processes that need to happen in order, in our case, to achieve a healthy pregnancy. And there's like no other time in your life that so much has to come into sync. Like not when you're 6, like not when you're 90. When you are trying to conceive and become pregnant, there is such a symphony of movement and heat and communication that has to happen. And Eastern medicine works off of that system. Western medicine works off of the physical system. Okay. So if you have tubes that are blocked, if you have excess tissue in your pelvic cavity that needs to be excised in the case of endometriosis, Western medicine can do those things, okay? Can remove and boost the sort of function of the substances of the body. And that's why sometimes with IVF or fertility in general, those patients who go see Western medicine doctors, they achieve pregnancy and they have no problem with a little bit of help of Western medicine. Then we have the women who walk in and they have sort of unexplained infertility and all their sort of like physical aspects of their body are have been checked out by Western medicine and still yet they can't get pregnant. And they come in and we get them pregnant in like 1 month. Okay. These are the patients who just needed Eastern medicine to work off of the sort of synchronicity of the body and the work off of this movement or this chi of the body to align to get everything to happen in this cascade that needs to happen. Then there are the patients, the most complex patients who come in usually to see us because they've tried everything and they have both going on. They have the sort of substances of the body needing a little work, and they have the energetics or the heat of the body needing to be worked on. And this is where integrative care is the best kind of care, where we work with Western providers to create this sort of global optimization of fertility and pregnancy and achieve the patient's goals.
That's super interesting. I mean, that they make it sound like it's so easy for people to get pregnant, like, oh, just, but look at how much has to go into it and how much has to be right. And if one thing is even slightly off, it can mess everything up.
Yeah, I mean, there's probably, if I had to guess, probably like over 100,000 little cascades that need to happen in the body for a pregnancy to be achieved. And yeah, if one thing is sort of ticked out of place, then the sort of waterfall effect from that one thing being out of place can sort of butterfly out, right? And so we work to sync up all the systems, which I think is really sort of missing on the Western side, even at the highest level, IVF. So Eastern medicine works to bring that communication and that synchronicity of the body together. IVF goes and turns off the communication and then sort of injects an override with medication. So basically, they're turning off the communication from the brain to the ovaries, and then they're injecting high doses of gonadotropins into the ovaries so that the ovaries can sort of build off of that. And so it's two different approaches, but I actually think if we can get both to work together, and yeah, this is where we see really amazing results.
Yeah, I mean, like I said, I have PCOS, and that's obviously a complex thing that I didn't realize was so complex until later on. But you're right, with Western medicine, it's here's the medicine, like take this. I mean, yes, it did help me get pregnant. I did have my baby, but nothing. nothing helped heal the other stuff that was going on internally. The inflammation that comes from it, the high cholesterol that can come from it. I mean, like all of these things, it's just slap the Band-Aid on, get you pregnant, and then like that's all they do, you know?
Yeah, and yeah, which I have no problem. Like a lot of Eastern medicine practitioners sort of have a bias against Western medicine. I say it's like it's a tool. Like it got you pregnant. Like that is, the most amazing achievement, a goal, to reach for that Western medicine can help. But what we see, often in PCOS is they go in for IVF and they have these really high numbers of follicle counts, and so they're sort of told that they're going to do well. And and in fact, what's happening with those follicles is that they're really stalling out. They're not maturing well because of the inflammation surrounding the ovaries and insulin dysregulation of the hormone communication. And so they end up getting, very few blastocysts from a large cohort that they pull. But what we can do is come in and we push away that inflammation and we get the body to regulate its insulin pathways much better. And the combination then can result in higher numbers of blastocysts and then, preserve fertility thereafter.
I didn't realize how big of an impact inflammation has
Oh
on
yeah.
the body. It's crazy.
Yeah. And
And
I think,
these things that you're not taught obviously in school or, by your Western medicine doctors.
yeah, and I think inflammation can be sort of this global term. I think that in particular, the women who come in to see us, fall into usually, two buckets. It's like the PCOS or the unexplained infertility, which is often a silent endometriosis. And they both have their own version of inflammation. And so, yeah, PCOS's inflammation is about insulin resistance. And when you have, I'm sure you know this, but I'll just review it for your patients, but insulin is takes is created by the pancreas and it takes glucose, so sugars that you eat, and it puts it into the muscle cell. So insulin goes in, takes glucose and goes in. And the muscles need glucose to function well. But insulin resistance has usually a genetic component where the muscle tissue doesn't uptake the insulin. And so then the insulin is in the bloodstream instead of the muscle tissue. Okay. And so if it's in the bloodstream, what they found in patients who have PCOS, they have a higher proclivity for insulin receptors around their ovaries. And so that insulin that's running in their bloodstream, instead of going into their muscle, then, it travels down to their ovaries and attaches to those insulin receptors around the ovaries. Now that creates, you can think this is not like the physiological, most accurate explanation, but what I like to tell patients is that when the insulin attaches to the ovaries, it creates sort of like a haze or a fog around the ovaries. And then FSH that's coming down from your brain, which is the hormone that grows follicles, follicular stimulating follicles, stimulates follicles, can't really break through that haze. Okay. And so then you have this big stalling out of follicles. You have a lot of follicles, but you have them mature very slowly. And you really need a dominant follicle to reach a certain size, to grow basically to a certain size before you get ovulation. And so this is why you have this really long stalling of the follicles in women with PCOS. And if you don't have ovulation, then you don't have your period. So then this is where you get these long 90-day cycles. And so for those patients, what we work really hard at doing is clearing inflammation with the needles over the ovaries, but also having the patient work on clearing insulin. And then, we use these supplements like inositol and other sort of functional medicine supplements so that if you clear the inflammation, which is insulin around the ovaries, you get that big, nice surge of FSH that can break through from the brain to the ovaries, hit those follicles, and they can grow. And when follicles grow, then you have ovulation. And so that's how you return a cycle for a PCOS patient. That's also how you get better follicles and more mature eggs in a PCOS patient who's going through IVF. So that's PCOS. And then you have inflammation on the endo side, which is different. Inflammation with endometriosis, which is when the endometrial tissue leaves the fallopian tubes and enters the pelvic cavity. So, most women have some retrograde menstruation and they have some endometrial tissue enter the pelvic cavity. The majority of women can or have the genetic ability to sort of sweep up and get rid of these flecks of tissue that come through the fallopian tubes. Women who have endometriosis don't have that detox pathway or have like a stunted pathway that allows their body to take care of this excess tissue. And instead, the body sees it as an attack on the body. So there's a hyper response from the immune system to attack this endometrial tissue in the pelvic cavity. Now, if your body can't get rid of the tissue because there's no vaginal opening in the pelvic cavity, so the tissue just kind of hangs out there and the body can't process it out, then it will continue to attack the tissue. Endometrial lining in your uterus grows because of estrogen. Okay, so as your follicles grow, they give off estrogen, and that estrogen goes to your uterine lining. It thickens your lining in preparation for implantation. Now, if you have endometrial tissue in your pelvic cavity, that tissue is also fed by the estrogen. And so it will grow and it will respond. It'll sort of feed off of the estrogen in every cycle as you have, your follicles develop. And the body is like, what is this tissue that's growing in my pelvic cavity? And it attacks, and the hyperimmune response basically puts women with endometriosis in a constant attack mode. So that when you have an embryo that has foreign DNA, it has the paternal DNA in it, the body thinks it is already so hypersensitive to foreign tissue in the reproductive tract that it will attack the embryo, right? Whereas otherwise, if the body was not in a hyperimmune state, there's like this amazing synchronicity that has to happen. The body like sees the embryo as foreign but doesn't attack it. And so that's the inflammation that we talk about with endometriosis is this immune hyper response. And you think of when you get sick or like when you have a mosquito bite, you can literally see the immune response, right? You have a fever, it's heat, it's inflammation. That's sort of the inflammation that's sort of happening in your pelvic cavity when you have endometriosis. Now, it can be silent and you have no idea it's happening, but it's an immune component that is not allowing for the embryo to either attach and then doesn't allow it to grow successfully. And this is where we have like recurrent miscarriage that is in an unexplained infertility diagnosis. It's often silent endometriosis with this sort of like hyperimmune activity.
So interesting. I mean, yeah, I didn't really even know all of that about endometriosis in particular, especially that women who don't have it can sometimes have the retrograde. That's
Yeah.
really.
And it's usually just like flecks of tissue and the body just sort of like swoops it up. And they have a certain like women who don't have endometriosis also can process out excess estrogens in a way that women with endo can't. And so it's important for women who have any like excess tissue pathology, so endo or polyps or fibroids, to be taking a supplement called DIM, which allows for attachment to these excess estrogens. The molecules in DIM attach to the excess estrogen, allow them to process out, which they otherwise wouldn't be able to. And if you decrease the sort of excess estrogens, then you don't allow these excess tissues to like grab on and sort of feed off of it and like grow in that way.
So what about, I know a lot of times with acupuncture, a lot of people use like herbs with that. Is that something that you do? Does everybody use them? Does it depend on the patient? Like, how does that work?
Yeah, it depends on the patient. I say we start with acupuncture because oftentimes we can achieve pregnancy with just the needles and just getting the body to sync up. But in complex cases, especially PCOS and endo or adeno, where you have like deep layered systems that are dysfunctioning, we often put herbs on top. Herbs you can think of, well, okay, so Western medicine comes from plants, right? So medication comes from plants and then they single out a molecule and then they package it in sort of like a pill or a shot or whatever. Eastern medicine is like that in that it takes compounds the from nature, so from plants, but it preserves let's say, the full composition of all the molecules, let's say, in the leaf. Okay. That provides, and the Eastern medicine philosophy is that all of those molecules that are in the leaf are important and work off of each other. So that if you isolate one, you are taking away the way it was intended to be produced. Okay. So this is why Western medicine, it's very potent, but it also comes with side effects. Herbs are equally as potent, but have less side effects because you get the sort of accumulation of what nature intended for those compounds, how they work together and sync up together. Then you have to be consistent about it, and it works slower and over time, but then but is just as strong over time. You just and you have less symptoms. So like the Western version is like everything, sort of, it's sort of like the masculine version, right? It's like isolate it and get it out there, right? Like force it forward. Nothing wrong with that. But the sort of feminine version of medicine is take the whole and slowly apply it to the body, and the body will change over time. So you have sort of two things doing the same, two ways to affect the body, two sort of energetic differences, though, of how it is applied. Both are useful, but absolutely for these complex cases where maybe one shot of one molecule just doesn't quite get to the root of the complexity of what's going on, let's say for endometriosis, they really don't have a medication that treats endometriosis, right? That you can cut it out, and in IVF you can take Lupron for 3 months, but you can't do that all the time. So endo is like an immune response of the body, and it is a physical response of the body with the tissue. And Western medicine can't really get at both yet, right? They haven't found a molecule that does that thing yet. But Eastern medicine, in its sort of beautiful nuances, can address the layers and systems of the body as a whole, and because it preserves the plant as a whole. And so, especially for the most complex cases, herbology is amazing and can be used as a tool when sort of Western has failed.
I'm curious, was it hard to learn? I mean, because I'm sure there are a lot of different herbs out there. Was it hard to learn all of
Oh
them?
my God, it was so hard. It was the hardest thing I've ever done. Like I went to a really good undergraduate school and, did a lot of math and but anyway, Eastern Medical School, acupuncture school was the hardest thing I ever did. It's a 5-year postgraduate degree, and now it's a doctorate degree. And it's full time. So it's a long, arduous program. And so you learn acupuncture, you learn Western medicine, because the patient comes in and says, I have this. You have to know what that is. Then you have to know how to put acupuncture and Eastern medicine theory on top of it. And then with herbs, you learn the pinyin of the herbs, which is like the alphabetized Chinese names of the herbs. You learn the Latin, and then you learn like their function. And it was so hard because there's no like memory tool you can like attach to pinyin, because it's just sounds. It's not like, there's no no, there was like a lot of Quizlet. There was a lot of memorization, peer memorization. It was really difficult, but it's so worth it if any of your listeners are like interested in Eastern medicine. There's a great sort of intro book. It's called The Web That Has No Weaver, The Web That Has No Weaver. And it's a really good book into like the philosophies, the foundational philosophies of Eastern medicine.
It's interesting because, now, I mean, we have computers and internet and things like that, but think about all the people who were just figuring this out a long time ago, like having to figure out what each thing did and just remember it. And
Oh my
I
God.
can't
I know.
imagine.
I know. And like even yeah, with the rise of ChatGPT, it's like and Claude is like there, of course I use it in my business but and even with fertility, like even on the Western side, there's a lot of things that come up wrong. And of course it will get better, but there is something in the medicine, especially Eastern medicine, that is because it combines basically the Chinese were looking at nature and describing medicine in terms of nature that sort of ChatGPT misses. So, like for example, they describe a an infection as either a wind heat or a wind cold. Okay, so they're using the language of nature to describe what's happening. So a wind heat in Western medicine, you can think of as wind, like you've caught something, and heat, which is like fever. Okay. And wind cold in Chinese medicine is you've caught something, wind, and there's like a damp, like a coldness to it. So this is usually like a bacterial infection. Okay. And so with the rise of I think and I've been like looking at AI recently, studying it and like the how it breaks up and finds like the statistical next, you know, piece of a word. There's some sort of like lost in translation in the romanticization of how you describe a what's happening in Chinese medicine. It's like again it's sort of like the very masculine ABC = DEE way of collecting information, and there's something about AI that misses the substance that you can't see, like the chi, like the heat in the description of the medicine. So I digress. I mean, I could go on forever, but
I'm sure, though, that that's something that things like AI could never really capture.
I
That needs a
wonder.
human, you know?
I wonder. Yeah. I mean, I think my job's pretty secure because I don't see like robots doing acupuncture, but maybe
I don't know that I would trust a
someday.
robot for that, you know? Like,
Maybe someday. I mean, they're doing surgeries, so maybe they could probably put in needles. Maybe I should reevaluate. I think for a long time I'm okay.
yeah. Well, and I do think that there are people who are naturally better at this. I mean, I know you said that found that you were naturally better than some of the other people in your program. The person I saw was amazing. She specialized in, the fertility stuff. And I had seen another one later, and I'm like, this is just not
Not the
like I'm
same.
I'm not getting that from this, you
Totally.
know?
I like to say also like if you've been to acupuncture and you're like, oh, I didn't like my acupuncture, it didn't quote unquote work for me or whatever. Like when you go to a dentist and you don't like the dentist, you don't like stop going to the dentist, right? You like go and find a better dentist. And I would say that's what I say to people who are like, oh, it didn't like work for me. I'm like, well, try another. I think also a curious mind is good at acupuncture. I think why I do well with it is because I have both the sort of like the analytical mind, but I'm also like very much a creative, and the two of them can web a lot of complex information together and see maybe pathways that of what's going on, especially in complex fertility cases that maybe someone who has a more one or the other kind of mind can't see. I mean, well, like I'm a visual person, so I can like see it in front of me, this whole web of history and symptoms and Eastern medicine, Western medicine, functional medicine, like all together and start to make the connections.
And I think those are the people that tend to be better, is the one who can see that whole picture and, not say just Western medicine is right or just Eastern medicine is right, but that they both have their place for their
Totally.
particular things, working
Totally. And I think
together.
that in both professions, you see a bias against the other. So the people who tend to go into acupuncture, like Western medicine has failed them in some way. And so then they will project their own bias against Western medicine to their patients. And I think especially fertility patients are just like, I just want a healthy baby. I don't like care how I get there. So like, for example, we have often like patients come in and we run their labs, and let's say their TSH, their thyroid is at like a 3.4. And in Western medicine, that falls within normal range under 4. But in Eastern medicine and also in fertility medicine, like REIs will try to get the thyroid below a 2.5 to help hold a pregnancy. And as an Eastern medicine practitioner, sometimes we have like acupuncturists are like, well, I'm going to take like 5 months to work on the thyroid, and we'll bring up the thyroid, and like you'll have to come twice a week for 5 months, and then we can start working on fertility. And I'm like, F that noise. Like the point is to get you to your healthiest baby the fastest. And if that means just taking a little bit of levothyroxine, get your thyroid function up and running, the heat of your body up and running while we're doing our thing with acupuncture, the combination of the two gets you to your family faster. And that's the point. And I think sometimes practitioners sort of like lose sight of that because of their own biases.
Which I mean makes sense. I mean, in an ideal world, we would have all the time in the world to fix everything that's wrong.
Totally.
But, when you're battling infertility and, racing against the age clock and all of these things, like
Yeah.
we don't want to spend 6 months getting our body ready. We just want
Yeah.
to get the baby.
There is like a unique urgency versus someone who's just coming into acupuncture for just wellness. Okay, we have time. Like, okay, you want to decrease your anxiety, but you're not trying to, have a baby before you're 42. Like, then we have the time to, sort of caress the body into its optimal function. And we can always do that in postpartum, but we understand that the women who come in have really been through the ringer and are looking for someone to help get them to their family the fastest.
Do you also see male patients, or is it mostly
Yeah, I would say
women?
it's the majority are women because they're the type of, especially type A women, because like the lawyers and the nurses and the people who have like had a professional achievement because they have otherwise sort of achieved their way into everything, like organized their life into achievement. And they're like, why am I not, getting pregnant or holding a pregnancy? And so like, let me go find out the next thing to do. And it's often like acupuncture. And also, the burden of infertility lands on women because every month they physically see that they are not pregnant. And the male partners don't have that physical change every month. Don't see their period blood. It's not hitting them. It's the idea of infertility is in their head, but it's not physical for them. And so almost every patient we see has is female, and whether or not their partner then comes for acupuncture once we establish that there's male factor is dependent on how the males perceive acupuncture, which I think a lot of men are slightly afraid of it. Especially fertility acupuncture, like they think that we're going to needle into their like private area and like their testicles. No, we
Like some
don't
kind of
needle.
torture device going on
No,
over there?
absolutely not. How we access the reproductive system in men is actually when if they're face down, we can needle into their sacrum, which is where the nerves of their reproductive system leave the spine and innervate their reproductive parts, if you will. So basically, we can put needles in the back and affect like their sperm quality and count and parameters. The other thing about getting men in is that there is a little bit of sort of cultural machismo associated with whether or not their sperm can get their wife pregnant. And so there's almost like an avoidance of trying to of having their numbers run. So we ask every patient who walks in to have a semen analysis or their partner to have a semen analysis and a DNA fragmentation test. And sometimes, maybe like 50% of the male partners, there's some resistance, like, oh, we haven't tried long enough, like you're overly worried, and that's a real shame. So how I like to spin it is to have the female ask their male partner, hey, like say, hey, like let's just get you a semen analysis and a DNA fragmentation test to rule you out, so that like the outcome for them is that they just like off the table, versus like let's check your sperm and to see if they're like messed up. Like it's like a tone
Yeah.
shift. And I think it's easier to receive for men if they're like, oh yeah, like we're just gonna then I'm scot-free. Like we don't have to talk about this anymore.
Sense.
Yeah, but a lot of the time there is some male factor. More than 40% of cases now are male factor. And if that's the case, then we ask the male partners to come in. And if they are willing, we often treat couples at the same time, like same appointment, same time. Or if they can't get in or not willing to come in, then we have them on a set of very well studied antioxidants that can change semen parameters within that 7-week period as spermatogenesis happens. And so we ask, like, you have to be consistent about these. And if we need to, we'll put them on herbs as well to treat them, but like offsite, basically.
Yeah, men are something else when it comes to fertility. It's like all of these things that women put themselves through and the testing and the shots and everything. And they
Surgeries.
have to
Yeah.
do one thing and can't do
Yeah.
it.
Yeah. I mean, they're like, shout out to the good guys out there, because they are there. But I think it lands with this idea that if there's something wrong with their sperm, then they're not like, manly enough. I mean, that also happens with women, right? Like there's this stigma, like I can't, like my body is failing me as a woman if I can't get pregnant. Like I mean, we work a lot with the psyche and offloading all of that burden that women are coming in on their shoulders, saying, like, we're going to get you there, we're going to walk you through this, like this is there's no shame in this, there's no guilt, like we are going to get you there. And the other thing that we do well is, and because I've been doing this for 10 years, is like, if you have not, if you're reserve, if you still have eggs, if your reserve is not gone, I viscerally believe that I can get you to pregnancy, whether through me or to the right people who can. And women who come in have been, again, like just in this dark isolation. And so I see the full arc. Like I can see how it ends. And women are sort of at the peak of that arc, and they just can't. And sometimes they're like, I don't know if I want to keep doing that. Like, how can I keep doing this? And I have the vision that they don't. And so I say, we're going to get you there. I'm going to get you the right people. I'm going to be the side sleuth in your pocket too, that, we're going to look in places your doctors haven't looked. We're going to look everywhere, and we're going to try everything. And I'm going to help guide you there. And it, like, it lifts women out of the drag of the mental space that they're in, and it can be what they need. I know that we can get them there and to the right person, and then to their family.
And I think it's helpful to feel like you have like an ally, like you're not in it on your own, that there's somebody like walking there next to you trying to help you figure it out, not, brushing you off or just trying to throw another
Totally.
pill at it, but like actually trying to be there for you.
Yeah, and yes, and someone that you can talk to, because it's still taboo. And so, people don't even tell their friends. And even like sometimes when women run into each other here, even still, like they know each other and they run into them, they get like, oh, she'll know that we're like trying to conceive. And I'm like, you're going through the same thing, right? But anyway, there's that. And we are here and we spend an hour with our patients, and a lot of it is talk therapy too. Like, come here and like, yeah, let out that pent up like sadness or rage or emotion that you're holding, because we're here to hold it for you. And that's our job. We want to be the place where you feel safe to talk and to get the real like energetic stagnation and tension out, because that also heals.
And just a random question, just because I'm curious. Do most people come in being afraid that it'll hurt, or are they?
Yeah. If you haven't had acupuncture, most women are afraid, or I mean, most people are afraid. And I think everyone is then surprised at how little they feel it. And a good acupuncturist knows how to needle well. Like there's something called needle technique, which then the patient doesn't feel the needles. I liken it to like maybe, you just touching your skin with like your nail. That it's just a little, we call there are some spots that are a little bit more spicy than the others, like hands and ears and skin with less like fat or muscle underneath tends to be a little bit more spicy. But like points on the leg and on the thigh and in the abdomen, really patients don't feel at all. And I think a lot of people are surprised by that.
I was surprised by that. I was like, I don't know
Yeah,
what I'm
nice. Yeah.
getting
Spread the
myself
word.
into. And I was like, oh, wait, that's not bad. And then, at first you kind of lay there like uncomfortable because you're like, this is new. I don't know what's happening. And then, a few weeks later, I'm falling asleep,
Yep. Totally. It's like the most immediate thing it does like right away is downregulate the nervous system. And so yeah, people are always also very surprised that they fall asleep. I had like if I every day one of my patients would be like, I was just kind of laying here and I was like, well, I don't think I'm going to sleep. It's in the middle of the day. And then like I woke myself up like snoring. And you can see it on their like aura rings that they're like all of their biometrics go down. They go into like the deepest sleep that they'll get, even more than they would at night in acupuncture. And that's the needles working off of the energetics, sort of bringing down the nervous system and creating like a safety that the body maybe doesn't experience otherwise, which allows them to go into a deep sleep.
If only we could all have it every day so we could have that that peaceful moment
I
of
know.
sleep.
I know. I get mine once a week too. And I'm like, I have the resources to do it every day. I should.
But we're always just so busy and
Yeah,
yeah,
that's the
doing
thing.
everything we do as moms and people and
Oh yeah.
yeah.
And this is actually like a good point. A lot of women come in over scheduled and rushing, and I like to say like there's a lot of shame for women in fertility around their stress levels. Like if only I were less stressed, then like I would have better outcomes. I'd have a pregnancy that hell I would have, like, and I say again, F the noise. We are animals. We are meant to have stress. Like you look at squirrels, like they have a lot of stress. Okay. But what we're not meant to do is have consistent stress, like high cortisol levels every day, all day. So what I ask patients to do is to find, starting really minimally, I say find one moment per day where you come fully out of like fight or flight. And so that could look like when you're making your coffee, you go outside and you face the sun and you let the sunbeams like hit the back of your eyeballs for 2 minutes. 2 minutes. You don't have to like you don't have to get into full meditation mode if that doesn't resonate with you, or like during your lunch break, you go outside instead of sit at your desk. And so that just allows for that cortisol to break. And when your pituitary sort of controls all things that have rhythm. So your stress levels that have rhythm, your hormones that have rhythm, your sleep cycle that has rhythm, and your hunger cycles that have rhythm. But it can only do one of those things at once. It can only prioritize one thing. And so if you have constant stress and your pituitary is constantly talking to your adrenals to pump out cortisol, then it won't have the ability to regulate your hormone pulses down from your brain to your ovaries. And so then you'll have like dysregulated hormones. That's why you have to come down. You have to give the pituitary a chance to like switch its focus at least once a day. And so start with that. And then you'll see you when your hormones regulate better, you'll see outcomes change basically.
I need to make that a point to start doing that because I definitely have high stress all day.
Yeah, I what I
Just
what I actually so I mean, who doesn't? What I say and what I tell myself is is to stop over scheduling myself. Okay, so I found that I would, let's say, do 3 podcasts in a day and also run to the gym and pick up my kids and do the blog posts, blah blah blah. So like it was just one thing after another, and even like physically going to the appointment. Okay, so I have all my wellness appointments, my my massage and my hair and my acupuncture and so then even going from one wellness appointment to the next, I'm like, oh my God, I gotta get up from here and I gotta rush over there and then I gotta go through this traffic and I gotta pick up my kid, blah, blah. And so like there was no real presence in the day. And there was always like this sense of urgency. And so now I try to schedule one thing a day. And you get to that appointment, or like let's say you have to, I don't know, do some activity with your kids or whatever. It's like, reading to your kids' day at school, like you do that one thing a day, it'll slow down the urgency, like slow down the pace of everything, which then tells your body, oh, okay, we're not running from a lion on the savannah.
right. Yeah, because your body doesn't really know the difference, right?
Right. Nope, sure doesn't. Yeah.
So if people were interested in finding out more information about you, where would they go for that?
Yeah, so our website is aphroditefertility.com. We have virtual appointments if you're not local to San Diego, where we go over the coaching aspect of fertility. We do the diagnostic work, we do the digging. We can help in a lot of ways. Whether you're trying to conceive naturally or you're going through IVF, we're here to really be your advocate and help you get to your family. And then all of our socials are Aphrodite Fertility as well.
Well, thank you so much for coming on and sharing. I mean, I learned so much already today, and I'm someone who is somewhat familiar with acupuncture, but yeah, I definitely learned a lot. So thank you.
Thanks for having me. It was great to chat with you.
Thank you so much, Emily, for sharing all of this amazing information with us. Remember, fertility isn't just about doing more. Sometimes it's just about understanding what your body needs and what it's trying to tell you. If you've been feeling stuck, one small step you could take is to just explore acupuncture. Even just having a consultation or trying a session or two to see how your body responds. For many women, it can be a way to support your body, reduce stress, and feel more connected to what's going on in your body. And if nothing else, it's a reminder that there are other options beyond what you may have already been told. If this conversation resonated with you, please consider sharing it with someone who might need it, or leave a quick review on Apple or Spotify. It really helps the show reach more loss and infertility families. Thank you so much for tuning in, and remember, we're all in this together.